need someone to talk to and you don't know what to do, call us 214-4400 when you're feeling all alone and they turn their back on you. Call us 214-4400. Call us 214-4400. Call us 214-4400. Call us.
You're listening to the Kind Counseling Podcast. Please be sure to like, share, and subscribe. Now back to the show.
Got it.
All right. So yes, I mean, let me just start, man. All right. Welcome to the Kind Counseling Podcast. It's your host, Dania Roberts, and I'm flying solo today. My two co-hosts have abandoned me. They have gone on trips and all kinds of stuff they're doing. So I'm here with the one and only Dr. Pierre Artie. How you doing, sir?
I am well. It's good to see you, Mr. Roberts. It's great. It's great to be here, and I thank you. I consider it an honor to be asked to come onto your podcast and to just kind of shed some knowledge, just to be able to share it, to have a one-on-one discussion with you. This is truly an honor. So thank you very much.
Yeah, I mean, obviously you're not a stranger to the show, so we're always grateful when you come on and give us insights. Yeah, I was really looking forward to talking to you about a little bit about personality disorders and you know and also mood disorders, specifically narcissistic personality disorder and bipolar disorder, because those two specifically, there's been a lot of misconceptions about it. People kind of throw the words around, or you're bipolar or you're narcissistic. And I wanted a professional to actually talk to the public about what these things really mean as opposed to just throwing those terms around like that, because then they take on a whole different meaning. Right? So, go ahead.
No, it's true, and I think it's a very interesting topic. Wherever you'd want to start, wherever we can take it, but I'd like to start by saying that in terms of personality, we all have traits that
Right.
people can pick up, that people can detect,
Mhm.
and I think based on the traits that people see, folks can then label somebody with, oh, you're histrionic, or
Right.
you're narcissistic, or you're a narcissist, and so on and so forth. But
Mhm.
when it comes to a disorder, like a personality disorder,
Right.
that's we're talking about a whole different game. We're talking
Okay.
about somebody who's not just having a trait, but is behaving in some fashion, and it's not like the person has just been behaving this way yesterday, but
Mhm.
even from early adulthood has
Okay.
manifested some form of inner experience of how they experience the world or how
Mhm.
they behave with others that is manifested in what, let's say, the DSM-4 will say it's rigid personality, it's inflexible personality. They're
Mhm.
not aware that they are being, let's
Mhm.
say, pains in the butts. They have
Okay.
no insight into what's going on with their interactions with people.
Mhm.
And with specifically this personality disorder, which has its own manifestations,
Right.
there's no remorse. There's no remorse. It's involved with a form of idealized grandiosity. I'm all that and a bag of chips, and you must recognize that. It could be
Okay.
real, it could be fantasized. So there's also a need for admiration. You have to admire me because I am exceptional, I am special.
Mhm.
And as I mentioned before, with this specific personality disorder, people can get involved with taking advantage of other people,
Mhm.
and there's no remorse, which is really, really unfortunate. And so
Okay.
imagine somebody behaving in this way from very early adulthood until, their adult life. And oftentimes these individuals come into treatment not because they volunteered to, hey, I have a problem, because the inside is
Mhm.
off. But
Right.
somewhere along the way, the partner, the wife, the husband may have said something to the effect of, if you don't get help, I'm out of here. because
Right.
I can't take it anymore. I can't take it. The kids can't take it. The in-laws
Right.
can't take it. Your friends can't take it. Or the boss may say something to that specific effect. If you don't get some help, I care enough about you. You're a good employer, but if you don't get some help, you're making life horrible for everybody else here. You're out of here. And then the person is forced into treatment, and where these types of behavior patterns may be explored and hopefully, you know, treated appropriately. So again, there's a difference between personality traits
Right.
and a personality disorder, which is a mental illness, which is
Right.
diagnosed in our little DSM-5,
Hmm.
and has specific manifestations, or I should say, criteria
Right.
for diagnosis. And
Okay.
for the narcissistic personality disorder, it's like I believe 5 out of 9 criteria,
Right.
which has to do with some of those things which I mentioned before. This incredible sense of grandiosity, I'm all that,
Mhm.
entitlement, like, hey,
Right.
this line is long for the movie. This is who I am. I shouldn't be expected to wait with everybody else because
Right.
I'm
Right.
too special. So
Right.
all of these, and then I mean, not even joking, but very serious about it, and they get upset if you're not being treated special in a special way. So that's what we're talking about here. And it really is problematic.
So if we were to go backwards, right? I mean, I guess there's some dispute as to where some of these things start or how they start. But in terms of your clinical experience, typically, what do you find as to be the cause of a personality disorder?
Well, it's an interesting question you're asking, uh,
Okay.
because like many things, unfortunately, there's no one cause.
Okay.
It's multifactorial, multifaceted, and it's pretty, yeah, it's multifaceted. It could involve a number of things. It could involve the upbringing, parental attachment,
Okay.
modeling behavior from what they saw, how mom behaved, how dad behaved, how people behaved under stress. Could it be involved with those things? Um, Biological. There is, you know,
Hmm.
I found out there is some evidence that of some kind of genetic and neurobiological factors
Okay.
that can increase vulnerability. Not that it
Mm.
causes it, but just being
Right.
vulnerable to it kind of leaves
Okay.
you open to it, you know. And then I mentioned trauma. Oh, trauma is a big thing.
Okay.
Being
Okay.
exposed to trauma, how one responded to trauma, the lingering impacts of trauma,
Right.
and trauma may very well mean parental abuse,
Okay.
uh,
Okay.
and not just physical, but you know the psychological thing. Because
Okay.
one of the interpretations of this kind of disorder is a person who has really low self-esteem, and so as a response
Hmm.
to protect
Right.
themselves, they develop this grandiosity, like, and but the grandiosity is essentially trying to protect that sense of low self-esteem. So
Right.
um, the answer to the question is that it's multifactorial. We don't exactly know, but
Okay.
if you take a particular person or a case and you kind of go back into their childhood to see, well, what happened? What was your relationship like with your parents? How did your parents treat you? Were you
Hmm.
exposed to any trauma? Was there abuse in the house? Was there abuse outside the house? Did
Hmm.
did children make fun of you when you were in school? Did the teachers make fun of you? Did you
Hmm.
experience excessive you know, bullying
Right.
from people? Did someone berate you too much? Was your father your father or your mother the kind who would, I don't know, just make fun of you if you have bad grades or you were not successful? Were the expectations too high that you did not fulfill them? And so to make yourself feel better,
Mm.
you develop this fantasized idea of who you are. Um, it could even be genetic. Maybe, you know, somewhere along the way, maybe dad was similar, maybe mom
Okay.
was similar, maybe auntie was similar, somewhere along the way. But we haven't found the exact causes, but clearly there are um, multifactorial contributing factors. I would call them contributing factors.
Okay. Now, so you in some circles, people say, well, there's no hope for somebody with NPD. You know, nothing can change that. Like, what are your thoughts about
Oh no, I'd say that that is wrong. I wouldn't
that? Okay.
I wouldn't say that. For any personality disorder,
Right.
there is hope. There's treatment. There's treatment out there. There is hope. A
Mm.
lot of it will depend on the person's enthusiasm, desire to change. If there's some kind of uh, uh, chipping against that protective shell of grandiosity, if they can come into some insight,
Mm.
I think all of those things, will provide an element of hope. The thing is, like many illnesses, like many psychological illnesses, the it's not that we're looking for a cure, we're looking for treatment, and it's not going to
Okay.
come like this.
Right.
It's going to come from ongoing
Right.
psychotherapy, ongoing treatment, ongoing, hey, let's take a look at this interaction. Let's see what went wrong. Would you
Okay.
acknowledge that maybe you had a part to play in this interaction?
Oh,
You know?
so it sounds like you're saying like consistent psychotherapy could be helpful for individuals in this situation.
Oh, absolutely. Absolutely. And there are specific forms of psychotherapy that have been developed. There's
Right.
I believe there's the schema therapy. That's one where
Mhm.
you the person can take a look at the specific schemes in their life.
Mhm.
That's also used for depressive disorder. There's psychodynamic psychotherapy to understand the symbolism of behavior patterns or things that have happened in one's life. Yeah, there's absolutely reason to hope. It just takes a while.
Okay. All right. So I mean, it sounds like you're saying so it's more of a well, maybe I should just ask you specifically in your because I know you did private practice as well as in clinics.
Mhm.
In terms of what you've seen, typically it's a response to childhood trauma. It sounds like that's what you're saying.
Yeah, that can be a contributing factor in terms
Okay.
of, um, a person is exposed to a particular trauma that's so intense. So I guess I don't want to be redundant, but the word is traumatic, that they
Right.
have to find a way of protecting their
To
psyche.
cope.
They have to
Right.
find a way of coping.
Right.
And this, unfortunately, is a maladaptive way of coping. And it's to such an extreme that the person unfortunately doesn't even have insight that, wait a minute,
Mhm.
I'm being selfish here, or I'm being too self-centered. um Understand that all of us need a certain level of narcissism to move forward.
Right.
Mr. Kami Roberts needs a certain level of narcissism to be bold enough to continue with this podcast, to believe that his audience wants to hear what he has to say, and that he can indeed run the show. So you need a certain level of
I got you.
confidence for that. And
Right.
I need a certain level of confidence to believe that, hey, you know what? I can get to medical school, even though many have been rejected, and maybe I can hang in there and graduate and be a physician. And maybe
Okay.
I have the knowledge base to do so. But
All
when you're
right.
thinking that, you're beyond that,
Got you.
to the point where it's like, look at me,
Okay.
don't bother with anybody else. I'm
Got
all
you.
you need to look at, do for me, and my expectation is that everybody else will do so.
Mhm.
Then it
Okay.
becomes problematic.
All right. So would you say that this is something that I mean, obviously, would you say this is something that a parent should teach a child, like when they're young, in terms of being empathetic towards others, or considering other people, that kind of stuff?
Oh, absolutely. I think any parent should do that. I think that should be the basics of parenting, as far as, empathy,
Hmm.
learning to share, learning to
Right.
say please, learning to say thank you. Just the very basic things. Like, it's a good point that you're making, because
Hmm.
maybe that person with the narcissistic personality, NPD,
Right.
we call it, maybe that person has never really learned to say thank you or
Like
please.
social
Like, there's no
skills.
need for please, because it's got to
Right.
come to me anyway.
Right.
And unless this is, I guess, addressed in a way, um, you can grow up and have a very powerful position and treat the whole world as
Right.
if it belongs to you, and
Right.
and that's not right.
Okay. Right.
I don't know
Okay.
if you know anybody like that, but
Not at all. Not at all.
okay.
Well, I was doing a little bit of research before we jumped on,
Mhm.
and it seems like it's almost this is 50% more diagnosed in men as opposed to women. Now, would you say that's the case because it's more obvious, or are women can hide it better? Like, what do you think about that?
Well, yeah, the statistics are what they are. Certain personality disorders or even traits tend to show up much more in men than women.
Right.
But understand that there may be a cultural influence also. For example, in terms of behavior
Okay.
expectations. Uh, Overall, I think historically and in society, if a man behaves in a very aggressive manner, affirmative manner,
Hmm.
or even, in a there are role expectations. So some things may be permitted for men,
Hmm. Hmm.
and not for women. And then if a woman, let's say, responds or behaves in a much more emotional type of manner,
Hmm.
people may say, "Oh, this person has, I don't know, borderline personality." Um, I mean, yes, based on statistics, you are correct. But I think that there's also elements of societal expectations involved with those
Hmm.
surveys.
Okay.
Men, historically, we have been, I would think, much more aggressive.
Okay.
Um, than women, and I think we would tend to express that more often, more it's more commonplace. So I can imagine that yes, indeed, people would probably see the particular type of personality traits more with one sex than another, and
Okay.
not just narcissistic personality disorders, but also for men, like antisocial personality disorders
Right.
too, which goes
Right.
with that.
Right.
Yeah. Yeah.
So I another aspect to personality disorders also is I was reading recently M. Scott Peck's book
Mm.
People of the Lie, right? It's a
Yes, yes.
classic, right? As well as some other psychiatrists I've read that they strongly believe that there's a spiritual component to this.
Hmm.
And I was just wondering what your thoughts are in terms of like possible like demonic possession, like they were talking about from a spiritual perspective. You have any thoughts on that?
Um, Demonic. I think a demonic possession. Well, first of all, you can't prove it. I don't think. I
I
don't know.
suppose.
Yeah, it's evidence based.
Yeah.
But I will comment that spirituality can play a very, very positive role in this,
Hmm.
in helping people uh to how would I say, handle their feelings, handle their emotions, handle their impulses, trying to
Hmm.
gain some level of empathy, as you said, trying to understand what it's like to walk in the other person's shoes.
Hmm.
I think spirituality is, depending on how it's handled, could be, a wonderful tool by which people can be helped. Um, Hopefully in a positive way, not in a negative way. I
Hmm.
can't attest to demonic influence, but I think as Christians, many times we tend to demonize negative manifestations.
Okay.
People just kind of behaving out of whack. We say, it's a negative spirit. And sometimes it's
Right.
just become part of our Christianese.
Right. Hmm.
But I will say that there is a place of positivity for people who can incorporate healthy
Hmm.
spirituality in their treatment. I would, really recommend that.
Yeah. I mean, I meant more like extreme behavior.
Yeah.
Like in terms of I mean, I don't know if you've seen The Exorcist, not to that degree, but but just in terms of behavior that is far above what the person normally engages in, right?
Well,
So
well,
I'm sure you've seen some of that in your office.
yeah. I'd say anything is possible.
Yeah.
I'm not an exorcist. I do pray for
Okay.
people.
All right.
Um, I mean, I've dealt with some situations where I thought it was just something other than what I was seeing, beyond what I
I
was
got
seeing,
you.
just the manifestations. Um, and still, there is room for psychotherapy.
Right. Right.
Um, and I think for those extreme cases, we'd have to talk about it and see what's going on. I think when you're
Okay.
speaking about spirituality, you'd have to also make your own spiritual assessment in terms of, well, what has the person been doing? What practices have they been engaging in?
Okay.
Yeah, you'd have to explore that kind of thing. You know, what's their spiritual history like? Um,
Right.
and see what has been, what what has gained entrance into the home, so to speak.
Right.
You'd have to
Right.
make a spiritual assessment, see what the belief systems are. Um, what's the prayer life like?
Okay.
All of those things
Okay.
need to be taken into account.
Okay.
Hello, virtuous women. It's your girl Dania, and I'm back. I'm back to ask you guys, have you registered yet for Declutter Your Home workshop? Listen, this is going to be a great workshop for anyone that wants to get tips and tricks on how to declutter your home and how to stay decluttered. We all have a room in the house. We all have a drawer in the house. We all have a closet in the house that needs to be decluttered, and I'm going to help you get started doing that. So if you haven't registered yet, go ahead and register today. Lock in today. The link is right down below. I'm putting it down below for you. So go ahead and sign up for this 2-week workshop. We're going to be doing some amazing work, and we're going to hear how we can declutter and stay decluttered. Okay? So go ahead, sign up, invite a friend that you know may need it. All right? Share the link with someone that you know and sign up together so you guys can do the work together. Okay? So I look forward to seeing you there. Again, the link is right down below. It's a 2-week workshop and it's only $50, guys. Only $50. Okay? So I look forward to seeing you there, and I believe God has some great things in store for everyone that will participate. All right? So you guys take care, and I'm going to see you soon. Bye.
Okay, so the second thing we wanted to talk about was the word bipolar, right?
Mhm.
So, it seems almost like if someone has a change in mood, that are automatically branded as bipolar, right? So,
Yeah.
is it more than just a moody person when somebody's given a bipolar diagnosis?
It's so much more than,
Okay.
a moody person. And what you're saying is, at least the stigma, and that really is unfair,
Right.
unfortunately, when you label people in this way. All of us can be moody. Listen, if I don't sleep at least
Or eat.
6.5 or eat, yeah, you can
My
call it,
wife can tell you that.
you can call it, mangry.
Right.
But yeah, but if you don't, those vegetative aspects of who we are as creatures of this world, in terms of appetite, if we don't eat well enough, or eat at specific time period, if we don't sleep well enough, these things can all, and then the stress we go through every day, it's
Right.
enough, and the news, um,
Yeah.
all of this can lead us to a place of irritability and moodiness.
Right.
The kids are not doing good in school, or something going on with your relationship at home. All of this can lead to a certain level of moodiness. But the thing is that moodiness, which we are all susceptible to, can last for a moment. I don't know,
Right.
maybe a couple of hours,
Right.
maybe a day. You get moody, you're grouchy, whatever, whatever. But when we're talking about a bipolar illness, which
Mm.
is a mental illness,
Right.
which is diagnosable,
Mhm.
we're talking about days of a
Okay.
particular mood
Okay.
that impacts someone's function. If I'm moody, I can still go to work, get my work done, and maybe people will stay away from me. But with the bipolar illness, depending on if you're low, which is you can fall into a major depression,
Okay.
or high, and I'm talking
Mhm.
about mood now, which can be either mania or hypomania, depending on the level.
Right.
But you're not. It can last for days. I believe with the DSM, it's at the very least 4 days. It can go to a week, and even go for weeks.
Right.
Where the person, it's beyond moodiness. You're not able to sleep,
Right.
and you may feel a sense of energy where even after not sleeping for a couple of days, you still feel energetic.
Right.
You know,
Right.
and
Right.
and and you're not able to function, and that irritability that the person can experience can go from mild irritability to maybe even comical, humorous, engaging type of behavior,
Mm-hmm.
to even overflow into maybe dangerous, hostile behavior.
Okay.
And once again, the person doesn't have the insight to know that, wait, they're going into that territory. So it's manifested by several things. Again, a big, inflated sense of self, a certain grandiosity.
Mm-hmm.
Um, you feeling like you're all that. I mentioned about the sleep. Some people go into excessive spending
Right.
money they don't even have, charging up, the charge card excessively,
Right.
or giving money away to people that,
Right.
take all my money out the bank and I'm just throwing it out in the street. This kind of behavior, or even
Right.
some individuals will get involved with, this one, and that one on a sexual level,
Right.
and they're not well, you see. And so
Mm-hmm.
all of this speaks to uh, a mental illness, where it has, and then unfortunately, when they come back to themselves, meaning regular state of mind, people are oftentimes embarrassed. They're like, "Oh my gosh, I did that!
Right.
Oh, I did
Right.
that! Oh my, where's my money?" You
Right.
know,
Right.
and so that is a serious mental illness that needs to be addressed. Whereas just being moody, we
Right.
can all um, we can all be susceptible to being moody. Yeah.
I had a question about people being misdiagnosed because I recently you know Kanye West, the rapper, right?
Yes.
He talked about he said that he was diagnosed with bipolar, but he was misdiagnosed where he really had autism, right?
Really? Oh, I didn't
Yeah,
know that.
yeah, this was a few months ago,
Okay.
or maybe earlier in the year. But how common is that, and how devastating can that be in terms of misdiagnosing
Yeah. It can be pretty devastating because it speaks to the treatment. Your diagnosis will then dictates treatment, you see.
somebody?
But
Right,
let me just step back a little bit and
okay,
speak about mood and bipolar for a
okay,
moment, because it reminded me that when I was learning about this, I have to say mood can be compared to today's weather.
okay.
For example, today it was pretty warm. That's the weather. So that's the mood today, was warm.
All
But
right,
then we're in the fall, and the
right,
fall is the season. And
okay.
so you can say with a bipolar illness, it's more the season as opposed to the mood, which is the weather.
So
Because
what is more long term?
exactly,
Got you.
exactly, the mood.
Okay.
Okay. So now to go back
The
to your
misdiagnosis, right?
wait, your friend Kanye, right? Yeah, yeah.
Hey, yeah, my friend. Right.
Uh, how common is, I don't know the statistics on how common misdiagnoses are,
Mhm.
but it does happen. It does happen, and I'm really sensitive to that because by the grace of God, I've been trained to make these diagnoses based on specific criteria. But understand that we're speaking about man-made criteria that
Right,
are made so that we can speak in the same language, and
right,
also that we can bill. We have diagnostic
right,
codes. Right.
right.
Now, the thing about psychological or psychiatric diagnoses is that it's all based on the self-report. It's
Mm,
based on objective data. It's all
right.
based on family report and how the person has been behaving. And so at times I may take this data and
Mhm.
process it in such a way that out of me will come a particular type of diagnosis,
Right.
because based on the time element in which I'm dealing with all these manifestations.
Mhm.
Sometimes an individual, the diagnostician, may learn of something that took place later on, or the person may start manifesting something differently later on that may then influence the diagnosis and say, hey, I thought this was such and such, but it actually is
Right.
such and such based on what I'm finding out. For example, somebody may come to me with a depressive disorder based on the symptoms, and I will diagnose, let's say, a major depressive disorder or a dysthymia, which is a
Right.
what a persistent depressive disorder.
Right.
But then a year later, they come back and they tell me, oh, doc, you know, I had 4 nights, I couldn't sleep, I had all this energy, I spent all this money, blah, blah, blah. That speaks to,
Right.
wait a minute,
Right.
that depression flipped over into a manic state. So now my diagnosis has to change to a
Okay.
bipolar. So
Okay.
I don't know specifically in Mr. West's case,
Right.
change. But I will say that these are two, I would say, divergent type of diagnoses where you
Mm.
have, and maybe they can present in a similar type of way at a particular way.
Okay.
I'm not a developmental psychiatrist, so I do know
Mm.
of autism, but that's not my specialty.
Okay.
So that maybe there was a particular way that he, you know, based on his mood, how he presented that merited that diagnosis. And then maybe in terms of the long-term treatment, other factors may have come into play that
Right.
kind of shed light into, wait a minute, based on the behavior, it's more autistic. And then you know what? It's all a spectrum also. It's not
Right.
like it's just one thing. It's, you know, there's
Mm.
a whole spectrum having to do with autism, similar to, you know, narcissism. It's a spectrum too.
Right.
Some people may just be very, very confident, while others can be in a grandiose type of way, become pains in the butts and think that they're the only ones who can do such and such,
Right.
you know.
So all right. So one of the things that
But oh wait, let
oh,
me
go ahead.
another comment
Sure, sure, sure.
in terms of you,
Hmm.
since you mentioned about misdiagnoses, it's a very important topic, and it's one, you know, that merits its own time. But as
Right.
people of, as Black people, as people
Yeah.
of color, as
Right.
people of different cultures being
Right.
expressed in this dominant culture, we are many times
Mm.
susceptible to misdiagnoses based on who's doing the diagnoses,
Right.
who's doing the diagnosis,
Right.
because we may not behave in a particular way
Right.
that the person, the clinician,
Like it's
is
used to.
aware of.
Right.
I
Right.
mean, yeah, when you talk about, you know,
That's good.
religious beliefs or religiosity,
Right.
come on, you know, we oftentimes will say, and the Lord said to me this, and the Lord said to
Right.
me that. You know, I heard from God. God told me this. God told me that.
Right. Right.
You know, whereas someone who may not have that background,
Right.
they go, "Oh wow, auditory hallucinations."
Exactly. Right.
Yeah, yeah. Or you know, you hear people in church, you know, speaking in tongues because we
Right.
come from that maybe evangelical background, so it's just
Mhm.
part of what we, you know, how we do. And
Right.
someone who may not be familiar with that may erroneously
Right.
misdiagnose the individual. I
Right.
know this has been done in the past because,
Right.
you know, it's just unfortunate. And that's why we need appropriate diversity and representation in all areas of life, so that the
Mm.
appropriate care can be, the appropriate diagnosis can be made in order for individuals to get the appropriate care. It's got
Okay.
to be
That's
it's
good.
got, yeah, it's got to be
Good.
culturally sensitive.
That's good.
Yeah.
I was gonna say earlier that one of the reasons why I always referred people to you was that you're very thorough, right? And you know, clients come back to me and they say like, "Wow, I spoke to him for like an hour and a half. Like he was like really," and I was like, "Hour and a half." So because the thing is, whereas other people, if I other psychiatrists that I refer to, clients have said, "Well, they spoke to me for 5 minutes and
Oh,
prescribed medication." And they're saying, well, how could that person possibly know me in 5 minutes to do that? So maybe you could just speak a little bit about
yeah, that's, well, I can speak for myself. That's unfair. Um, you know, Cami,
that. Yeah.
um, I grew up, in Crown Heights,
Okay.
in Brooklyn,
All right.
and Kings County Hospital was the go-to hospital.
Right.
It
Right.
was like whatever it is, it was the go-to hospital, and I've been there, you know, as a child, and
Mm.
coming from Haiti,
Mm.
I at times saw physicians there who did not know anything about Haitians, not know how to speak Creole or anything like that. And yet, these were the individuals who
Mm.
were placed to care for people who didn't speak the language or did not,
Right.
you know, who didn't speak the English language. And these clinicians may not have been aware of the person's cultural background. It's not just, you know, limited to Haitians, of course. I mean, you
Right.
could be, you know, Chinese, Japanese, Russian, whatever it is.
Right.
But I think it's very important that if we hold that position of power, and it is a position of power, It's a
Right.
position of yeah, it's a position of power and influence. And so we want to do right by folks.
Mm.
Um, Seeing families who may not have been represented as far as clinicians who were looking after them, um, and seeing that growing up kind of impacted on me that if
Mm.
I would ever be in that position of influence, that I
Okay.
should do whatever I can to kind of get beyond the boundaries and touch those lives so I can understand the person better. You
Right.
know, I think we are all of us owe our patients that type of the time and
Hmm.
and the investment. I mean, beyond the fact that they're paying us,
Right.
but
Right.
we have to really understand the individual. And I think for us as clinicians involved with the person's with the psyche, with the person's mental state, I
Mm.
think, and we're not perfect, of course, but I think we have
Right.
to do everything we can to understand that individual, and that's going to take some time. It's like the question you asked me about spirituality, and my
Yes.
response is, hey, you know what, if that's going to be in the game, then we have to do a spiritual investment. I mean,
Right. Assessment.
assessment.
Right.
I'm saying investment.
I
We
got
have,
you.
well, actually, it is a spiritual investment, but we have
Right.
to do a
I
spiritual
got you.
assessment, see what their practices were, see what doors were open, see,
Mm.
was whatever's going on, and just kind of explore that so we can get as much as we can, a 360 type
Mm.
of view of the person. And before, in my opinion, prescribing something that may potentially have some side
Right.
effects. I
Right.
mean, you may have a situation where it's like, oh, this person comes in, I can see right off the bat they're depressed, they're bad off, and it's that's my diagnosis already, and cool. I just need a few other information, but I already have my mind set on that. And you may be right, it may happen. But I
Right.
think if you've never met the person before, it's important to kind of explore what's going on.
Okay. All right. I had, I'm going to ask you a little bit about just medication in terms of bipolar because
Mm-hmm.
I had a client who she was having bipolar or manic episodes,
Mm.
which were stimulated by stress and marijuana usage.
Oh
Right.
yeah.
So we kind of traced it back to every time that combination happened, she would have these manic episodes. So once we figured that out, like she stayed away from it because she didn't want to take any medication, and
Mm-hmm.
she stayed away from those two things, and she was fine for years.
Mm.
Right. So I was just wondering what your thoughts are just in terms of clients not wanting to take medication when prescribed, like that kind of stuff.
Wow. Um, it's interesting. In general,
Right.
people will separate the body, brain, and mind.
Okay.
Meaning
Right.
that,
Right.
yeah, yeah. Meaning
Right.
that, if you come to me, you have a cough and you spit out something yellow and green, and I'm like, oh man, come, you've got a pneumonia. Here, take penicillin and take
Right.
it for 2 weeks or whatever. Yeah, no problem, doc. I've got pneumonia. I'm going to take that, and because I want to be cured. But let's say another situation, a person comes and they're depressed or whatever, and you say, take this medication, it will help. Maybe,
Right.
not immediately, but give it some time. It'll help with the anxiety, the depression, or whatever is going on. A lot of times, well, I don't know if it's a lot of times, but many individuals may consider that uh, what they call a narcissistic injury or narcissistic trauma. Just
Okay.
bringing the word there because
Right.
it's like, oh man, you're telling me I can't take care of my own mind. You're telling me that I'm weak. You're telling
Right.
me that I don't have what it takes in order to deal with life's challenges.
Right.
And so people may have feelings about that, and some people, even some individuals who I've treated for schizophrenia, will
Mm.
say, it does remind me that I have an illness every single time that I take this pill, that I
Mm.
don't have some control over certain aspects of my mind or my behavior. And to me, that's offensive, that's insulting. It speaks to me of a potential weakness on my end. And
Mm.
so not and so a lot of folks, not to be reminded of that, will make the decision not to take the medication, or they will say, well, let me try and see if I don't need it. Even if the medication had worked for, for over a year, they say,
Right.
well, I've taken it long enough. Let me see if I can do without it, which is
Mm.
interesting because people will be less inclined to experiment. Let's say if they have high blood pressure,
Right.
they have diabetes, or
Right.
some chronic medical thing, they say,
Right.
hey man, that's my blood pressure. I don't want to have a stroke. I want to keep on taking the medication,
Mm.
or I have diabetes, then that's why I take this insulin. But with
Okay.
mental illness, it's just a whole different, I think, dynamic or mindset in terms of compliance with treatment. And I think that's something to be discussed with the patient in terms of how do they feel about taking psychiatric medications? Because it's not a matter of just, hey, take this antibiotic, in
Right.
7 days you'll feel better.
Right.
No, it's more of it requires a discussion to see how do you feel about, what does it mean to you to take this medication? Will the meaning change as you continue to take it? How can I make it better for you?
Mm.
Will maybe getting a shot, and there are certain medications now that you can get a
Right.
shot once a month, will
Mm.
that be better as opposed to
Mm.
taking a pill every day? Uh,
Okay.
so
So,
yeah.
so do you like for example, like we were talking about the like narcissistic personality disorder, right? So do you and you may have answered this already, right? Because so recently we had the whole thing with Charlie Kirk, right? That happened, right? And some people were not empathetic towards the him being killed. So could you see one event like that and say, well, oh, that person is narcissistic, right? In the sense that there's no empathy, right? I mean, like, meaning, can you see one symptom and say, in your mind as a doctor, that, like it starts trending in your mind, like that could be signs of a disorder, or you got to see seven other things first?
Oh, I first of all, just everyone has a right to
Right.
respond to an event any way they
Right.
would want to.
Yeah.
I'm sure when Martin Luther King was shot,
Right.
I'm sure there were people who were like, oh yeah, he deserved it. Oh yeah, that big mouth. Yeah,
Right.
now with those people, well, I would maybe think they have a mental illness, but still, but still,
Right.
everyone is clearly is entitled. No, I wouldn't not think that one response
Okay.
based on the person's uh, cultural influence, based on the person's um, upbringing, based on the person's maybe religious values, based on the person's political perspective, political belief system,
Okay.
all of that would speak to me of some type of narcissistic personality disorder. Um, as
Okay.
as I mentioned before, a personality disorder is a long-term kind of thing. It's like a pattern of emotional experience of the world and behavior that's
Right.
been present since, like, around adolescence, you know, that
Got you.
people have,
Got
and
you.
parents say, he's always been that way since he was little. I mean, yeah, man, he doesn't care who he hurts,
Right.
um,
Right.
um, teachers may have reported, yeah, he cut this girl's hair and he didn't even say sorry. Um,
Right. Right.
and then you see this, and later on, yeah, he stole this money from this guy who was, susceptible to it, and he didn't even feel bad about it. He did that in his 20s. And
Right.
so it's a long-term type of patterns of behavior involved
Got you.
that sense of entitlement. Yeah, I cut the girl's hair. It was in front of me. What's the big deal?
Right.
Yeah,
Right.
it's that kind of thing, that sense of um without remorse, without remorse, you
So
know.
so you're looking more for patterns as opposed to isolated incidents.
Oh yeah, yeah. We're looking
Okay.
for patterns. We're looking for something long term. As a matter of fact, it's unfair to any individual to
Right.
make such a diagnosis based
Mm.
on a momentary or cross sectional type of
Okay.
experience. You need something long term. You need other collateral information. Yeah, you would need that. So if somebody doesn't, let's say, have a certain sensitivity, I would
Right.
say, towards the assassination of someone, and that's on them. What's
Right.
behind that could be a
Right.
whole host of things. You know, hey, they killed Malcolm. You know, why am I going to cry about this guy? And so forth. You know,
Right.
people
So,
historical backgrounds and all kinds of things.
but well, I think I'm hearing you say basically that there's a lot more depth and nuance to this as opposed to just reacting to someone, in an isolated situation.
Absolutely.
Okay.
Absolutely. Yeah. And that's the word itself, nuance.
Okay.
And I
All
would
right.
say maybe historical nuance. Yeah.
Okay. All right. Listen, anything else you want to add to this, man? Because I feel like you've simplified it like so well, right? Like in terms of just looking for certain things as opposed to reactions. And that's one of the things I really appreciate about you. You can make complex things, seem understandable.
Yeah. Well, thank you very much for saying that. I appreciate it. I think that we who have a certain body of knowledge
Right.
should be available and willing to share it with everyone else who would need to know.
Right.
Like the scripture says, freely you have given. Although no, this wasn't free. I mean, I had to pay for school, but nonetheless, I want to be
Yes.
able to share it
Yes.
with everyone and make it as palatable as
Right.
possible from wherever the person's background is. I find your questions are on point,
Okay.
and people should understand that there are traits, and then there is the disorder, and the disorder is something that is diagnosable. It has
Mhm.
specific criteria to diagnose it, and
Mhm.
there's treatment for it. There's
Right.
treatment for it.
Right.
We all have traits.
Right.
We all can be a little histrionic, let's say, a little narcissistic. We all have traits, some
Right.
more than others. Uh,
Right.
but when you have a pattern where it's impacting upon the person's world as far as um, their family life,
Mhm.
their work life,
Mhm.
their interactions with people
Right.
outside,
Right.
um, we do not expect a layman to make the
Make it.
diagnosis,
Right.
but when you have someone who is like constantly in some kind of, you know, issue
Mhm.
with someone at work, someone at home, someone on the street,
Mhm.
there's an issue with a stranger, then you have to start wondering what the heck is going on here? What's going
Right. Right.
on? Yeah,
Okay.
yeah.
All right, sir. Well, listen, we're gonna wrap this up, man. I always appreciate you coming on and giving us some insights and making making complex things simple. So we once again always appreciate you, man. Thanks for coming on.
Well, it's my pleasure. Again, I consider it an honor to be on the Kami Roberts show. I'm not sure how you call it, but and you look great, man. You look great.
Kind
What?
counts a podcast, man.
Okay. All right. Well, thank you. You look great, and
Thank you, man. Thank
say
you.
hello to the wife for me. I would
All right.
appreciate that. And wait, was it her birthday I saw on Facebook or something?
Yes, 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 yeah, yeah. That's why she was in DC, right? She was
Okay,
celebrating.
okay. I thought I saw something like that. Well, happy
Yeah.
birthday
Well,
from me.
thank you, man. And
All right.
say hello to yours for me too, man.
Will do.
All
All right,
right.
guys. Take
Have
care.
a good one.
And like I said, anytime, man. Anytime at
I
all.
appreciate you, man.
Anything. All right.
All right.
Appreciate
We'll
you. Take
talk.
care. Bye
All
bye.
right.
If I ever took a loss, I learned a lesson. I won't ever think I'm better than the next man. I've been down before to come up, I ain't stressing. Baby, I'm too busy.